Hi, I'm Ashley. I'm a clinical psychologist working in Fairfield, and I use feminist therapy and cognitive behavior therapy in my sessions. Feminist therapy is a type of therapy that looks at women in a different way than most traditional therapies do. It puts interactions of gender, social issues, and power as main ideas in the therapy process. Feminist therapy was developed because our society was changing so much, and it was created because of the emerging needs and the different needs of women. So, for example, women were always kind of at home, working, taking care of children, and as society progressed and changed, and women started to work more, and because they were coming out of their shell and progressing, their needs changed, and so feminist therapy was created. Some ideas that feminist therapist does is it creates non-hierarchical structures, which means that men aren't more important than women, but also women aren't more important than men. It's all about equality between the genders. It also looks at race and social issues. So basically, feminist therapy puts every race and gender on the same playing level. So no one is better than the other. Traditional therapies that were mostly pioneered by white European males never really looked at anything like this before. So that's what makes it different. Also, empowerment of all people is a very important part of feminist therapy. So, increasing self-esteem, self-confidence, and really just empowering the client to live the best life they can is very central and important to feminist therapy. So, something that feminist therapy wants to change, a lot of other therapies are what we call androcentric, which is it uses male-oriented constructs to kind of draw conclusions about humans. So that means females are kind of seen as deviant, and males and their kind of chemistry and brain structure are normal. Also, other therapies are gender-centric, which means that in therapy, women and men have two different kind of paths of development, and even though both genders are human, they are still viewed as different. So feminist therapy hopes to get rid of the differences. Also, traditional therapies are deterministic, and that means that personality patterns and behavior are fixed when you are very young and they don't change. So feminist therapists like myself kind of think that you're able to change your personality and you're able to change your behavior at any stage of your life, if you have enough drive to do that. Lastly, the intrapsychic orientation, which is when you're blaming the victim and not really looking at other social factors. So other therapy tends to do this where they just blame the person and they're not necessarily looking at outside factors that don't have anything to do with the person. So, for example, other therapies would blame a woman for her deviant behaviors when in reality women are oppressed because of society. So feminist therapy likes to look at the whole, including society, and that's different from other therapies. So, as your future clinical psychologist, I am really committed to helping you grow, and I'm aware of all different types of oppression, including racism. And racism isn't usually looked at in other therapies, so bringing race into it and bringing more awareness to all different types of oppression is very important. I like to use feminist therapy because it brings awareness to social issues and other problems that women may have and that they are usually blamed for. that's not really their fault. So, for example, women have a lot of issues with self-esteem, self-confidence, sometimes eating disorders because of this pressure that society puts on us. And I like to look at that and say, it's okay to not look exactly the way that society tells us to. And for example, I like to treat people that have problems with anxiety and depression that come from social issues. That's a big part of feminist therapy. Also, I like to look at different types of relationships, whether they're abusive or if they're good relationships, and acknowledging them and recognizing what is healthy to a person. So, ways that you can achieve your goals in therapy is to be an active part. You won't be like a passive person in therapy. It's very important that I'm not the only one talking, that you as a client take the challenge head on and try very hard to work through your problems, because society tends to make women very passive, and I promise that you will not be passive in my office. You will be asked questions that really allow you to think and be able to express and be totally open. Also, some goals that I would like you to achieve in my office is to acquire skills to help fuel positive change in society. So I would like my clients to be able to change the stigmas that are placed on men and women. Also, I would like to see my clients develop self-confidence and self-esteem and be able to exude personal and social power in life. And also, a big problem that I would like my clients to work through is just trusting yourself and knowing your own intuition, and really working on self-confidence and self-esteem. And we do this by using cognitive behavior therapy, CBT. This process centralizes around changing thoughts and behaviors, not just one of them. And we take these bad behaviors and thoughts and we put positive ones in. So we use behavior modification, and that's all about thinking about your thoughts and your actions and recognizing which ones are negative, which ones are positive, and the impact that they have on others and yourself. So the only way that you can change is if you recognize the negative behaviors and try to change. So, for example, the harsh social standards we're pressured to live by. So if you want more information on feminist therapy, you can go to panicdisorder.com. You can call me to make an appointment. Thank you so much for watching. Have a nice day.